I'm Luke Joseph, founder and CEO of iFirst Medical Technologies. iFirst's objectives are to improve patient outcomes and relieve strain on ICU resources for COVID-19. iFirst has taken what used to be a $50,000 piece of lab equipment that measures blood clotting or coagulation and put it in the palm of your hand. Our device provides a graph of coagulation over time. This is an example of a normal coagulation profile, and it can replace multiple lab tests and provide actionable information earlier. Unfortunately, the death rates and overall cases of COVID-19 continue to climb. The latest data is showing that 5 people die every minute. At this rate, 15 people will die during my short presentation. Information is continuously being published on COVID-19, and patterns are beginning to surface that hold the answer to identifying the patients that are at the highest risk and treating them early to avoid admission into the ICU and possibly death. In one study, 70% of non-surviving COVID-19 patients exhibited massive clotting in their lungs and other organs. This is something called DIC. For survivors, it was only 0.4%. This is a generic profile, a generic coagulation profile of a DIC patient. Another interesting thing is that those that tested positive to COVID-19 show clear coagulation abnormalities upon admission. For the non-surviving patients, these coagulation abnormalities continue to get worse each day. And you can see this, the publications have shown this with the coagulation panels, and what we suspect is you would see the same thing with these coagulation profiles. And what you don't see is this happening with the survivors. The survivors, their coagulation abnormalities plateau, and they don't progress down to DIC. Another thing that they have found is administering anticoagulants early in the infection increases the outcomes. So what's important here is to test people as soon as possible, possibly at home, possibly at their doctor's office, and get people on anticoagulants as early as possible. This not only potentially saves lives, but it also can free up the limited resources in the ICU for other patients. Our analyzer is production ready and currently being tested by Underwriters Laboratories, and we expect to receive our CE mark in the next 2 months. iFirst wishes to partner with government agencies and manufacturers to increase the production of our analyzer and get them out to the field where they can save lives. By the way, massive blood clots due to exposure to cosmic radiation are one of the primary threats for astronauts. So if you're traveling to Mars, you might want to have one of our analyzers. Thank you.